Hello guys, welcome back to Army in White. Today we will be continuing our lecture from the last topic, that is cystic fibrosis. Today we will be looking into second part of cystic fibrosis. In the previous video we have watched about the different types of mutation from type 1 to type class 1 to class 5 type of mutation. Among them, class 1 and class 2 mutation is the most severe type because in class 1 and class 2 type of mutation, okay, there will be total absence of CFTR product in the membrane protein. What does that mean is that, let's look in the picture from our previous class. Here it is. In this picture we'll see this is the CFTR gene. Here the products from the CFTR gene will be total absent in the membrane protein. Okay, this is here, it is the membrane protein. Due to this, the severity is maximum. Okay, and vast difference in the testis of the male's genital is the most sensitive to the CFTR gene. Okay, and with the little developmental problem in the CFTR gene, there will be a serious problem. So what are the organ affected? Okay, what are the main organ affected by the cystic fibrosis? The main organ affected can be lung, liver, pancreas, stomach, and the testis. Okay, testis. These are the main organ involved in the cystic fibrosis. Okay, these are mostly affected. So here what we know, class 1 and class 2 is the most severe type. Why? Because the CFTR product is totally absent in the membrane protein, and vast difference is most sensitive to CFTR gene. Okay, and these are the organ involved. Okay, lung, liver, pancreas, stomach, and the testis. Okay, now here we need to understand one thing, and this is very important. Okay, in the sweat gland, everywhere the orientation of the this chloride channel. Okay, chloride channel is outward, but in sweat gland the orientation of this will be inward. Okay, let's see how it is. So for better understanding, let me first make this one like this. Okay, these are the duct cell. Okay, so what happened is that in the sweat gland, okay, this is the sweat gland, these are the duct cell, and here is the skin. You can see it. For understanding, this is one of the representative diagram, and here is the circulatory system. Okay, through the circulatory system, different ions like chloride, sodium will be entering here. Okay, so it will go to the sweat gland in the duct cell. What happens is that here the chloride channel will be actively absorbing the ions like the chloride ions. Okay, with the absorption of chloride ions, sodium will also be following. Okay, but the problem is that the water cannot follow them, so water have to be appear outside the skin as the sweat. So what happens is that the sweat will become hypotonic. Okay, the sweat will become what? Hypotonic. Why? Because the chloride and the sodium are being absorbed by the duct cell. Due to this, the water become hypotonic. That water will be the sweat. Okay, see here, the orientation of the chloride channel on sweat gland is inward. और different और दूसरा organ में क्या होता है कि ये जो orientation of the chloride channel होता है ना, inward नहीं होता है, इसलिए वो क्लोराइड बाहर निकल जाता है. जैसे लंग में हमने जो पढ़ा था उसमें ना, तो क्लोराइड आयन, इसमें क्या होगा, क्लोराइड आयन absorbed by the duct cell of sweat gland with sodium follows, and water cannot follow, so water will be appearing as sweat, and it is hypotonic. Okay, and it is क्या होगा, it is hypotonic. See, it is hypotonic. It will be hypotonic here. Okay, so activity of CFTR gene made sweat hypotonic. So we can say that now the activity of the CFTR gene, that is cystic fibrosis transconductance regulator gene, we know, right, that make the sweat hypotonic. Okay, during cystic fibrosis, CFTR is either absent or not working properly. Okay, because of this, either absent भी हो सकता है, नहीं तो not working properly. Okay, कब? जब cystic fibrosis होता है. Okay, so what happens is that from this sweat gland, what we can do is that we can test this sweat. If there is chlorine present, then there is cystic fibrosis. If there is no present, there will be some number given. Okay, if the chloride is more than that, there will be what? Cystic fibrosis. Okay, so let's look what test it is. Sweat chloride test for diagnosis of cystic fibrosis. See what we can do. We can do sweat chloride test for diagnosis of cystic fibrosis. Okay, so in note, what we can understand and to be kept in mind will be cystic fibrosis system is reabsorbing chloride in the sweat gland. Okay, in the sweat gland, what it does is, in the sweat gland it reabsorb, okay, what chloride is reabsorbed, but in other organ it actively secrete means it will give out, okay, the chloride will be given out, and in the sweat gland it will be reabsorbing, it will absorb. In mucociliary clearance mechanism we have looked about how does it work, why does it work. Okay, because of mucociliary clearance mechanism the mucus will become thin and it will be going towards the trachea and it will be digested in the highly acidic environment in the gut, in the stomach. Okay, in the normal epithelium we have talked about all this. Now if cystic fibrosis occur and if there is impairment or if there is some mutation in the CFTR gene, what will happen? If there is mutation in the CFTR gene, here we can see mucociliary clearance mechanism will not be working. Once the mucociliary clearance mechanism doesn't work, there will be microbes and foreign particle will be trapped there in the suppose if we are talking about this in the proximal part of the lung, there will be trapping of microbes and foreign particle. Okay, so once all this works, the cilia will not be working, so bacteria in the damaged area can be seen. There will be lots of bacteria growing there because if the microbes and foreign particle are not being thrown away continuously, they will be trapped together. Mucus will become very thick because the chloride is not collecting water along with sodium, so the mucus become very thick and there will be passage obstruction can be seen. Okay, passage obstruction will be seen because of what? Mucus become very thick and mucovasculosis will be occurring. What is mucovasculosis? Okay, mucovasculosis means obstruction of the passage, different passages in the respiratory tract. Okay, this is called mucovasculosis because of the thickening of the mucus. This is called mucovasculosis. Okay, so let's look what are the effects of on respiratory system. When we look about the effects on respiratory system, first of all there will be a problem in the upper and the lower respiratory system. There will be cough, bronchial wall destruction, pneumonia, lung abscess and the bronchiectasis. Okay, what we can see pneumonia, lung abscess, bronchiectasis. Okay, and what is bronchiectasis? When you look what is bronchiectasis, bronchiectasis actually it is the if this is the lung. Okay, if this is the lung, there will be some irreversible permanent increasing or like dilatation. Okay, here it will be something dilatation abnormal, but this is abnormal irreversible. Okay, once it happen it will never go. It is irreversible permanent dilatation of the part of bronchial tree. This is the bronchial tree, we know, right? See, there will be some type of permanent dilatation around this area, that is called bronchiectasis. During bronchiectasis what will happen is that there will the sputum with the patient of bronchiectasis will be very smelly, the foul smell. Okay, in bronchiectasis patients sputum is foul smell. So let's look, there will be also pneumonia and lung abscess. So what is pneumonia and what is lung abscess? Many people tend to think that pneumonia and lung abscess are quite same. Yeah, it appear to be quite similar, but there is a big difference. Okay, pneumonia and abscess, when we look about these two, there will be lots of difference. Okay, in pneumonia what will happen is that the air space is filled by the exudate, that is WBC, platelets, etc. Okay, and there are in this air space, that is this area. Okay, this air space become consolidate, and this is term is pneumonia. Okay, suppose this is our lung. Okay, so this is our air space. Suppose for just understanding, let me just draw. This is the air space, so let me draw here. This is the lung space. This will become consolidated. There will be lots of exudates, WBC, platelets, etc. Okay, so this will become consolidated. Okay, there will be lots of microbes, bacteria will be growing. But once the antibiotic, if the antibiotic is given and if it work and if these microbes, these exudates are removed, they are killed, then what will happen is that once it get okay, once these particles are removed, once these microbes are removed from here, it will remain as it is. Okay, the original architecture will be same as it was. Okay, so this is pneumonia. Once the medication work, the normal or the original architecture will be remaining as it is. But in lung abscess, this will be also the same condition, that is the air space will be filled. Okay, this air space will be filled by the exudates, microbes and all those pathogens. And the thing here will be that even after removal of all these things, the normal architecture cannot be restored. Okay, it will be damaged. So this is called lung abscess. Okay, in lung abscess the underlying architecture is always damaged. This is lung abscess. Okay, this is the difference between lung abscess and pneumonia. Okay, pneumonia, after the treatment the normal architecture can be restored as it was before, but in lung abscess we cannot do that, and this is very dangerous. Okay, actually pneumonia also dangerous, but after treatment, after giving proper antibiotics, after proper medication, removal of all those microbes, this is restored. But here in lung abscess we cannot restore. Okay, so in cystic fibrosis we have talked everything, like the chromosome involved, the exact location of or address of the chromosome, where it was in the 7q31.1, and we have talked about the mucociliary clearance mechanism. We have talked about in sweat gland, how does it happen, and the orientation is inward. The sweat appear, normally sweat appear hypotonic, but in cystic fibrosis the sweat appear to be hypertonic because of the presence of chloride in those ions. Okay, and what is the diagnosis test we do? The sweat chloride test for diagnosis of cystic fibrosis is done, and what is the amount we note? It will be more than 60 milliequilibrium per liter. Okay, then we can diagnose it as cystic fibrosis. Okay, in cystic fibrosis, okay, and if there is impairment in the mucociliary clearance mechanism because of cystic fibrosis mutation in those genes, there will be bacteria growing, there will be mucus become very thick, and there will be mucobasidosis. Okay, and things to be remembered here. And we have talked about difference between pneumonia and lung abscess. So, and we have also talked about bronchiectasis, that there will be a very foul smelling sputum in this patient. Okay, so I think we are clear with this topic, cystic fibrosis. And now in the next video we'll be talking something regarding maybe pathology or maybe other subject, but I'll be updating you. Okay guys, so thank you. Please like, share and subscribe. If you have any question, please write down in the comment section below, and thank you. Keep studying. Thank you guys.